with our electrolyte imbalances. Previously, we ended with hyperkalemia. Today, we are going to continue with hypokalemia, that is low potassium in the blood. So, let's talk about some of the causes of hypokalemia. We have certain medications like diuretics, example, loop diuretics, and then we also have thiazide diuretics. They help in wasting of potassium. They bring out a lot of potassium from the blood in addition to urine. We also have some beta agonist drugs like albuterol that also help in wasting potassium. And then vomiting and diarrhea. Diarrhea and vomiting, excessive diarrhea and vomiting leads to depletion of potassium from the system. We also have alkalosis. Now, either respiratory alkalosis or metabolic alkalosis, anytime that a person is in this state, potassium is shifted from the extracellular spaces to intracellular spaces, leading to fewer volume of potassium in the blood, which can lead to hypokalemia. Hypomagnesemia, that is low magnesium level in the blood. Magnesium helps in the reabsorption of potassium from the kidneys. When there is low magnesium levels, potassium is excreted more or out of the body. Magnesium also helps to maintain the sodium potassium pump. When magnesium levels are depleted, this pump is, should I say, weakened, and a lot of potassium shifts into the intracellular spaces, leading to low levels of potassium in blood. Now let's talk about the signs and symptoms of hypokalemia. We have lethargy, we have bradycardia, that is low pulse rate, we have paralytic ileus. We learned previously that potassium helps in the contraction of muscles, smooth muscles and cardiac muscles. So since there is low potassium in blood, cardiac muscles will not be able to contract effectively. Smooth muscles also kind of get paralyzed, leading to paralytic ileus, that is reduced in peristalsis of the small intestines. And constipation can also occur since our intestines are not being contracted enough to expel food. Constipation is likely going to occur. Muscle flaccidity, the muscles are going to become flaccid because there's no enough potassium to help in this contraction. Hyporeflexia, reflexes are going to be very low since potassium helps in muscle contraction and then nerve impulse generation. These are going to get very low. Now, how is hypokalemia treated? Let's look at the treatment of hypokalemia. We have identification of the cause. We have mentioned several causes that can lead to hypokalemia. One of it is medications like diuretics, beta agonists. If these medications are those leading to the hypokalemia, they can either be stopped or changed to different or safer ones. And we also have hypomagnesemia. Usually, if somebody have hypomagnesemia and it leads to hypokalemia, if the magnesium levels are not corrected, the potassium level is likely not going to be corrected, because if you keep on giving potassium and the magnesium level is low, the person is always going to go back into the hypokalemic state. So you have to make sure that the person's magnesium levels are elevated or increased to normal levels before you can treat the hypokalemic state. We also have administration of potassium. In mild hypokalemia, oral potassium can be given. In severe cases, IV is given, usually added to saline or other IV fluids. And we also have dietary potassium intake. So certain foods that contain potassium can also be given to the patient, or patient can be encouraged to consume foods that are high in potassium to increase their potassium levels. So now let's move to our next electrolyte. Now the next electrolyte we are going to discuss is hypocalcemia, that is low calcium levels in the blood. Some of the causes of hypocalcemia include vitamin D deficiency, hypoparathyroidism, chronic kidney disease, acute pancreatitis, infection, hypomagnesemia, and so many others. We know vitamin D is needed for absorption of calcium in the intestine. So low levels of vitamin D will lead to low levels of calcium in the blood. Then parathyroidism or hypoparathyroidism is the reduce in the secretion of parathyroid hormones by the parathyroid gland. The parathyroid gland helps in a hormone helps in regulation of calcium in so many ways. This is another topic to be discussed, but what we should know is that it helps in the reabsorption of calcium. Our next topic is hypercalcemia, that is high level of calcium in the blood. Hypercalcemia can be caused by certain cancers, malignant cancers like lung cancer and breast cancers. These cancer cells usually secrete a certain protein called parathyroid hormone related protein, and this parathyroid hormone related protein can make the action of parathyroid hormone, leading to an increase in calcium level in blood. We also have hyperparathyroidism. Remember, in hypocalcemia we said hypoparathyroidism could cause it. So in this condition, to hyperparathyroidism, that's increased level of parathyroid hormones, can lead to this condition. Increased level of vitamin D will increase calcium level as well. We said reduced level of vitamin D could lead to hypocalcemia, so the vice versa could also happen here. Certain diuretics like thiazide diuretics can lead to calcium retention, leading to hypercalcemia. And then we also have Addison's disease or adrenal insufficiency. In Addison disease, usually cortisol level is low, and cortisol is necessary or is needed for bone suppression. It suppresses the action of bone resorption. So when there is no cortisol in the blood, it means that bone resorption will not be suppressed, thereby leading to increase in osteoclast activity, leading to high level of calcium in the blood. Then we also have lithium therapy. Usually lithium has a direct effect on the parathyroid hormone, the parathyroid gland. It makes the calcium sensors in the parathyroid gland to be very sensitive. So even when there is small calcium in the high calcium in the blood, but it senses it as low calcium, thereby leading to more calcium retention or production in the blood by the action of the parathyroid gland. Then we also have immobility. So usually when people are immobilized for some time, the bones begin to bone resorption increases, so and lead to increase or bone breakdown increase, leading to increase of um, calcium in the blood. Now, what are some of the signs and symptoms of this condition? Hypercalcemia can lead to mental changes like confusion, depression. It can lead to muscle weakness. It can lead to constipation. Abdominal pain will be there. Then increased levels of calcium can cause kidney stones as well. Then we have arrhythmias. It can lead to irregular heartbeat. Hypertension can occur here. And then bone pain or osteoporosis can also occur. The treatments include treating underlying causes. If it is the cancers, treatment of these cancers or management can lead to reduced level and hydration, and then administration of loop diuretics, treating the causes as I've mentioned earlier on. Whatever that is causing it, treating the cause can help. Corticosteroids use or steroid replacement can also be done. Calcitonin can be given. Calcitonin inhibits bone resorption and increases calcium excretion. And then we also have a certain drug by bisphosphonates. Example, we have famidronate and then zoledronic acid. These drugs reduces the osteoclast activity, thereby they inhibit osteoclast activities, thereby reducing a calcium level in blood. So these are some of the treatments medical treatment that can be given in hypocalcemia. hypocalcemia. So now in our next video, I'm going to give you a short memory trick for the electrolyte imbalances and how to know their signs and symptoms.